Welcome to our video on heart health care for seniors. The heart is a symbol of vitality and energy, and protecting its health becomes increasingly important as we age. As Dr. Symbol of Vitality and Energy, Tim Johnson, a cardiology expert, shares, "A healthy heart is the foundation of a life full of energy." Nutrition expert Dr. Anna Martinez also advises, "Healthy eating and regular exercise are the cornerstones of good health." In this video, we will explore habits that are detrimental to heart health and provide practical advice to help you make positive changes. Let's discover how to choose a balanced diet, boost physical activity, manage stress, and improve sleep to ensure a healthy heart and a happy life. Before we begin, hit like and subscribe so you won't miss any of our upcoming helpful videos. Let's start the journey to caring for your heart. Number 1. Unbalanced diet. In the world of heart health, diet acts as a powerful agent, shaping the well-being of seniors in profound ways. Picture a typical plate laden with processed foods, saturated fats, and hidden sugars. While this might resemble a convenient meal choice, its long-term effects on the heart can be detrimental. Seniors, in particular, need to be acutely aware of their dietary choices, as age can exacerbate the negative impacts of a poor diet on the cardiovascular system. An unbalanced diet rich in saturated fats and trans fats often leads to elevated cholesterol levels. Imagine cholesterol as a sticky substance that lines the arteries, reducing blood flow to the heart and culminating in conditions such as atherosclerosis. Over time, this can increase the risk of heart attacks and strokes, posing a significant threat to senior health. The heart, a tireless organ, works diligently 24/7, and it relies on unobstructed blood flow to function optimally. Excessive sugar intake is another culprit undermining heart health. Visualize the sudden energy spike and subsequent crash that comes from a sugary treat. This cycle can increase inflammation and lead to insulin resistance, markedly raising the risk of developing type 2 diabetes, which is closely linked to heart disease. Furthermore, high sodium intake, often from processed foods, elevates blood pressure. A senior's heart works harder under such pressure, enlarging the heart muscle over time and potentially leading to heart failure. So, what can seniors do to reclaim their heart health through diet? Transitioning towards a balanced and heart-healthy diet is crucial. This involves incorporating more fruits, vegetables, whole grains, lean proteins, and healthy fats, such as those found in avocados and nuts. These food choices are rich in essential nutrients, fiber, and antioxidants, providing the necessary tools to combat cardiovascular diseases. Take, for instance, the Mediterranean diet. Envision plates graced with vibrant salads, olive oil, fish, and a sprinkle of nuts. Studies suggest that this eating pattern promotes heart health by reducing inflammation and lowering bad cholesterol levels. Seniors adopting such dietary habits not only protect their cardiovascular health, but also enhance their overall quality of life. Embarking on a journey towards a balanced diet involves mindful eating. This means savoring each bite, recognizing hunger cues, and appreciating the food's role in nourishing the heart and body. For seniors, partnering with nutritionists or healthcare providers can provide personalized dietary guidance tailored to individual health needs. Dietary changes are more than a preventive measure. They are an empowering step towards longevity and vitality. As we turn the focus to other lifestyle factors affecting heart health, remember that each positive dietary choice strengthens the heart, one bite at a time. Number 2. Lack of physical activity. Imagine a life where the heart beats with a rhythmic strength, bolstered by the simple act of movement. For many seniors, maintaining an active lifestyle is a cornerstone of sustaining heart health. Yet, the absence of regular physical activity can quietly undermine the heart's vitality, increasing vulnerability to various cardiovascular diseases. Inactivity poses several risks for the senior population. Picture the heart as a muscle, which indeed it is, relying on exercise to maintain its stamina and efficiency. A sedentary lifestyle can lead to weight gain, higher blood pressure, and elevated cholesterol levels, all contributors to heart disease. When the heart becomes accustomed to minimal activity, it loses a degree of its resilience, becoming more susceptible to conditions like coronary artery disease. Further, inactivity can exacerbate conditions such as obesity and type 2 diabetes, both of which are significant risk factors for cardiovascular disease. Consider how sitting for prolonged periods, a common scenario for many seniors, can lead to poor circulation, increasing the risk of developing blood clots and deep vein thrombosis. These conditions not only threaten the heart but can lead to severe complications if left unchecked. The antidote is as simple as it is effective: movement. Engaging in regular physical activity has transformative benefits for heart health. Imagine seniors embracing walking, swimming, or cycling, each activity invigorating their circulatory system and bolstering heart function. Exercise promotes weight management, lowers blood pressure, and improves overall cardiovascular endurance. For those who may feel unsteady on their feet or are managing chronic health conditions, low-impact exercises like yoga or Tai Chi can provide substantial heart health benefits while enhancing balance and flexibility. Even daily household chores or gardening can be counted as exercise, proving that every form of movement counts towards a healthier heart. The essentials of beginning or maintaining an exercise regimen include personal comfort and enjoyment. Each senior should tailor physical activity to suit their abilities and preferences, perhaps finding joy in group exercises that provide a social element as well. Healthcare providers can assist in designing safe and effective exercise plans tailored to individual health needs and limitations. The journey towards an active lifestyle begins with small, achievable steps. Encourage setting realistic goals, whether it's taking short walks daily or attempting new exercises gradually. In doing so, seniors not only strengthen their hearts but also improve their overall quality of life, with increased energy and better mood. Thus, as we transition to exploring other critical aspects of heart health, we understand that movement indeed is a medicine for the heart. A commitment to physical activity is an investment in a longer, healthier life. Number 3. Smoking risks. Visualize the lungs filled with smoke, the heart straining with every beat as it copes with the toxic compounds entering the bloodstream. Smoking, a well-documented foe of heart health, poses significant risks, especially for seniors. The act of smoking introduces harmful chemicals such as nicotine and carbon monoxide into the body, directly impacting cardiovascular function and overall health. Picture the effect of smoking as a gradual narrowing of the arteries. This process, known as atherosclerosis, reduces blood flow and increases blood pressure, placing undue stress on the heart. Over time, this leads to coronary artery disease, heart attacks, and strokes. For seniors, who may already be battling age-related changes in their cardiovascular system, smoking adds an unnecessary and potentially fatal burden. Beyond the immediate effects, smoking also reduces the supply of oxygen in the blood, forcing the heart to work harder to distribute oxygen throughout the body. Senior smokers might find themselves more frequently fatigued, with a reduced capacity for physical activity, which further compounds potential health issues. The combination of reduced oxygenation and increased cardiac workload accelerates the deterioration of heart health. The good news, however, lies in the body's remarkable ability to heal. Quitting smoking at any age brings significant benefits, and seniors are no exception. Imagine the relief experienced by the heart and lungs once the smoke clears. Within days of quitting, the heart rate and blood pressure begin to normalize, reducing the cardiovascular strain. For seniors committed to quitting smoking, utilizing resources like nicotine replacement therapies, counseling, and support groups can dramatically improve success rates. This journey is not just about avoiding further damage but actively reclaiming health. The cessation of smoking brings profound benefits beyond heart health, improving respiratory function, circulation, and immune capability. Encouraging seniors to quit smoking requires a supportive environment that respects the challenges they face. Family members, healthcare providers, and peer support networks can play a crucial role in motivating and aiding in smoking cessation efforts. By celebrating milestones and providing resources tailored to seniors, the path to a smoke-free life becomes more attainable. As we shift focus to another factor impacting heart health, it's essential to recognize that the decision to quit smoking might be one of the most impactful health decisions a senior can make. It paves the way for a healthier heart and a longer, fuller life, a testament to the resilience and capacity for transformation at any age. Number 4. Excessive alcohol consumption. Envision a glass raised in a toast, a symbol of celebration, yet when consumed excessively, it quietly transforms into a threat to heart health. For seniors, managing alcohol intake is crucial because excessive consumption can stealthily undermine cardiovascular well-being. Alcohol, when indulged in moderation, may have its benefits, but exceeding this can lead to a cascade of negative health consequences. The effects of heavy drinking stretch far and wide across the cardiovascular system. Imagine alcohol acting as a disruptive force, raising blood pressure and contributing to irregular heart rhythms. These developments strain the heart over time and can increase the risk of hypertensive heart disease. Seniors, who may already be managing age-related health changes, find that excessive alcohol only compounds existing challenges. One particular concern is the development of cardiomyopathy, a condition where chronic alcohol use weakens the heart muscle. Picture the heart now, unable to pump efficiently, struggling to meet the body's demand for oxygen. This condition can significantly impair quality of life, causing fatigue, shortness of breath, and an increased risk of heart failure. Furthermore, heavy alcohol consumption can negatively affect the liver, another critical organ for health maintenance. A compromised liver can exacerbate cardiovascular conditions by contributing to hypertension and fluid retention. This interconnectedness between organs illustrates the body's complex balance, which excessive alcohol compromises. For seniors, understanding moderation is key. The concept of one drink can vary in interpretation, but general guidance suggests that seniors should be particularly mindful, aligning with medical advice tailored to their individual health profiles. Moderation might involve limiting consumption to one standard drink per day, depending on personal health circumstances. Despite these risks, there's a positive path forward. Seniors can embrace a heart-healthy lifestyle by adopting responsible drinking habits. Imagine gatherings where mocktails and alcohol-free options offer celebratory alternatives without the side effects. Social support networks and healthcare professionals can guide seniors in making thoughtful choices that align with their health goals. As we explore more lifestyle factors influencing heart health, it's clear that mindful moderation with alcohol is essential. By choosing moderation, seniors can protect their hearts from avoidable harm, fostering a lifestyle that celebrates health and longevity. A life brimming with vibrant experiences awaits those who make informed choices, sustaining both their heart health and their overall well-being. Number 5. Poor stress management. Picture the mind and body under constant tension, the heart racing in response to everyday challenges. Stress has a pervasive influence on overall health, and for seniors, managing it effectively is crucial to maintaining a healthy heart. Chronic stress acts as an invisible weight, gradually exerting pressure on the cardiovascular system and amplifying the risk of heart disease. Imagine stress as a trigger, initiating a cascade of physiological responses. It elevates blood pressure, increases heart rate, and releases stress hormones like cortisol. Over time, these changes can contribute to hypertension and hasten the development of atherosclerosis by damaging blood vessel walls. For seniors who may face additional stressors like health issues or changes in lifestyle, managing stress becomes a vital component of heart health. Chronic stress also affects behavior, often leading to unhealthy coping mechanisms such as overeating, smoking, or excessive alcohol consumption. These habits compound the risk of cardiovascular disease, creating a cycle where stress and heart health issues feed into each other. Breaking this cycle involves implementing effective stress management strategies that offer both immediate relief and long-term benefits. Relaxation techniques are powerful tools in this regard. Imagine a serene environment where seniors can practice deep breathing, meditation, or yoga. These activities help lower stress levels by calming the mind and reducing the physiological impacts of stress. Regular practice can lead to improved mental clarity and better emotional regulation, both of which contribute to a healthier heart. Social connections also play a significant role in managing stress. Seniors benefit greatly from maintaining relationships with family and friends who provide emotional support and companionship. Engaging in social activities, whether through clubs, community events, or volunteer work, offers a sense of belonging and purpose that counteracts loneliness and reduces stress. Physical activity, previously discussed, is another exceptional stress buster. Regular exercise releases endorphins, the body's natural mood elevators, which help combat stress and depression. Even a simple daily walk can have profound effects on mood and heart health, making it an accessible and effective strategy for stress management. Finally, structured support from mental health professionals can provide seniors with personalized strategies to manage stressors effectively. Cognitive behavioral therapy or counseling can equip seniors with coping skills, enabling them to face challenges with resilience and a positive outlook. As we prepare to delve into another aspect of heart health, it's evident that mastering stress is essential for seniors. By developing effective stress management techniques, seniors not only protect their hearts but also enhance their overall quality of life, embodying peace and well-being. Number 6. Inadequate sleep patterns. Picture the serene onset of night, a time for the body to repair and rejuvenate. Yet, for many seniors, sleep becomes elusive, slipping through their fingers like sand. The importance of sleep in maintaining heart health cannot be overstated, as inadequate sleep patterns can significantly impact cardiovascular well-being. Envision sleep as a restorative process, essential for the maintenance of heart health. During sleep, heart rate and blood pressure decrease, providing the heart a much-needed respite from daytime activities. However, when sleep is disrupted or insufficient, this balance is upset, placing undue stress on the cardiovascular system. Over time, chronic sleep deprivation can lead to hypertension, increasing the risk of heart attacks and strokes. For seniors, sleep disturbances can be common, resulting from factors such as medication side effects, medical conditions, or changes in sleep patterns that naturally occur with aging. Sleep disorders like sleep apnea introduce additional risk, interrupting oxygen supply and putting extra strain on the heart as it struggles to compensate for irregularities. The consequences of poor sleep extend beyond the heart. Imagine waking up tired, the mind foggy, energy levels depleted. This can lead to a decrease in physical activity, compounding the risk of cardiovascular disease. Additionally, sleep deprivation impacts mood, leading to increased stress and anxiety, which further detrimentally affects heart health. Addressing sleep issues involves lifestyle adjustments and creating optimal conditions for restful nights. Maintaining a consistent sleep schedule is crucial, helping regulate the body's internal clock. Sleeping environments should be comfortable and conducive to rest. Consider a dark, cool, and quiet bedroom setting. Seniors might also benefit from calming pre-sleep routines. Picture winding down with a book, enjoying gentle stretches, or practicing relaxation exercises that prepare the mind and body for restful slumber. For those dealing with more persistent sleep disturbances, consulting healthcare providers can provide valuable interventions, from cognitive behavioral therapy to possible adjustments in medication. The journey to improved sleep involves patience and persistence, but the benefits are immense. Quality sleep revitalizes both body and mind, reinforcing the body's natural defenses and enhancing overall heart health. By prioritizing sleep, seniors set a foundation for better health outcomes, adding vitality to their days and resilience to their hearts. As we wrap up our discussion on habits affecting heart health, consider embracing these changes as steps on a rewarding path to longevity. Remember, nurturing a healthy heart is a commitment that pays dividends in quality of life and enduring wellness. Consider subscribing to our channel for more insights and tips on successful aging and health.